Welcome back to Between Two White Coats, a podcast designed to help you be the healthiest version of yourself. I'm Dr. Michelle Plaster, a family medicine doctor.
And I'm her co-host, Amber Foster, a family nurse practitioner. In our combined 30 years in medicine, we've seen a lot.
We're discussing key issues surrounding health and wellness, answering some of our biggest questions, overcoming health obstacles, and giving patient-centered advice in hopes of educating you and providing the tools you need to live a healthy life.
If you find our podcast helpful, please consider subscribing so you don't miss an episode. And don't forget to leave us a 5-star rating and review. This will help other people find our podcast.
Thanks for joining us. We look forward to serving you.
Welcome back to Between Two White Coats. Thank you for joining us. So Amber and I are talking about kind of a fun topic today, IV bars or hydration bars. They are popping up in lots of places.
They're mobile?
They're mobile, yes. They'll come to your home, or they're just driving around in RVs, showing up at football games. So what is a IV bar?
So essentially it is IV fluid. So either with additives, so like normal saline, which is just essentially salt water, with things that can be helpful for like if you had a stomach bug or if you have a hangover or if you need gut support. So there's lots of different options, but essentially you just go in, you have a needle placed in your arm, and then you get a bag of fluid.
Yes.
Where essentially you would have had to get that within some sort of medical facility realm and you're like really sick.
Yeah, absolutely.
So what's the helpful
So,
part
there
of
was a
it?
trendy thing, and it was mostly in California. I think these oxygen bars years back, and they did not linger. And I remember laughing so hard because you would go in and they either said that they put more oxygen in the air or they would put like a nasal cannula and oxygen on you. And I mean, if you have COPD or some horrible disease, getting extra oxygen is a good thing. But most of us are 100% saturated with oxygen all the time. And so you can't be 101% saturated with oxygen. So all the oxygen that you breathe in is not going to do anything when you're already 100% saturated. Yeah. So I was like, well, this ain't going to stay because there's no science behind it. But the IV hydration bars are interesting, and I think will stay, and I think do have a medical place because they certainly fix some of our needs.
Yeah.
Most Americans, I think around 75 to 80% of Americans are dehydrated.
Yes.
When we have wet things, it's not water.
Yeah.
We're drinking soda, we're drinking tea, we're drinking coffee, tea and coffee.
Energy drinks.
Tea and coffee have, like, we tell our patients and they're like, well, I have 4 cups of sweet tea a day. And I'm like, oh my goodness. But they have diuretics in them.
Yeah.
You lose more than what you get. So although you might put a liter of water into making tea, you're going to pee out more of that than you're going to keep.
Yeah.
So they dehydrate you. They don't hydrate you. So when you're not drinking water, you're not getting hydrated. And most Americans don't drink enough. They definitely don't drink water. And they're not hydrated. Yeah. So just by nature of getting fluids, it's going to help most people. I will say, this is something that typically happens in a medical facility, and please don't go somewhere that doesn't have medical staff that will make sure this is done safe. Because if we just talk about the foundation is the IV fluid, the bag of normal saline, that can hurt some people.
Yeah.
So people who should not get overhydrated, people who should not get a bag of fluid straight into their vein, are people who have serious congestive heart failure. You can volume overload. People who have kidney disease to the point where they don't like your dialysis or your stage 4 or stage 5 chronic kidney disease, your kidneys can't put out the excess as well. And so you may end up volume overloading. People who might have really bad electrolyte imbalances, you have to be careful about when you throw too much water in, it changes the percent of electrolytes that you have in there. And so there are some things that we like to talk to people to make sure this is the minimum amount of people. The young and healthies with no medications and no chronic illnesses, it's not an issue. You're gonna get extra fluid. If you don't need it, you'll pee it out. But I think the first thing is that it helps to hydrate people. So the fluid itself is important. The next thing is that we can customize these IV bags and give people what they need. So you go to the hospital, you get hydrated, but we put the certain medicines that you need in there. We customize it to what's happening to you medically. Well, in these IV hydration bars, specifically if you're in one where people are smart and they know what you need, they know how to ask you questions and help you meet your wellness goals, then we can help fix your problems. So we do IV hydration in our wellness center. You'll meet one of our nurses, nurse practitioners, or doctors when you come in, and we help make sure that what we're going to do makes good sense. And so in customizing which IV you would like, I would say that across the board, the most common and talked about IV is Myers therapy.
Yeah.
It's called the Myers cocktail. It's called Myers therapy.
It's a pretty color.
It's a pretty color. It has lots of stuff in it. But Myers cocktail or Myers therapy is named after Dr. Myers, who's a functional medicine doctor. I believe that he came up with this in the 70s or so. This isn't a new thing. And this really is sort of a help with most from a functional medicine world. So it has lots of vitamins and minerals in it. And collectively, some amino acids. Collectively, it helps with energy. It can help with people who are working on weight loss. It can help with inflammation and decreasing inflammation. Lots of therapeutic benefits. So a lot of people who are just sort of doing I want to stay hydrated and I want to get what my body needs, the Myers therapy is a good one to choose. And it kind of fits lots of things. That Myers cocktail or Myers therapy will often get a little boost of a couple other things for people with chronic pain. So sometimes we'll throw Toradol in there. Toradol is a non-steroidal anti-inflammatory prescription drug. And it can be hard on your kidneys like all NSAIDs. Yeah. And so if you are doing these IVs geared toward pain that have Toradol, just know that you can over Toradol. And I would say if you're doing that very often, you need to be having someone watch your kidney function. If you take ibuprofen every day, you need to be having someone watch your kidney function as well. So this isn't like a unique harm. There are over-the-counters that do the same thing. All NSAIDs can do this. But a lot of people will be able to reduce inflammation and reduce pain with the different things that are in the pain IVs. And that's great if it can help you reduce your pain medication.
Yeah.
If it can help you come off of opioids or use less of these addictive medicines, then I think there's a great therapeutic benefit to that. You mentioned GI.
Yeah. That's just because that's near and dear to my soul.
Near and dear to Amber, who has celiac disease. And so there are a lot of different things that mess up our digestive tract. And so in looking at that, I think the GI cocktails that in the IV bars are great because there are very specific amino acids and vitamins that help decrease inflammation in your GI tract, to help with the leaky gut syndrome, to help with, for you, if you even get traces of...
it makes me so sick.
Yeah, it makes you so sick. So if you get the smallest amount of something that your gut doesn't agree with. Now, maybe it's a person who's lactose intolerant and they get lactose. Yeah. Maybe it's a celiac person and they get gluten. But if there is something that is going to aggravate, then you get a lot of inflammation and it can stay. And
it's
then
just painful.
It kind of pulls your tight junctions of your gut apart and you can get this leaky gut syndrome and other things. So these GI IVs are kind of help to rebuild the GI tract.
Or if you just get the stomach bug on Christmas, like I did this past year.
Yes. So when you're super sick on Christmas and you have to bounce right back into work, this helps rebuild you. It's going to take, can you do these things? So are IVs necessary? Not for young, healthy people. You can do these things orally. It's going to take days to get that amount of hydration in and feel better, to get all of those vitamins in, and to have it absorb. So not only does IV give you the fluids, but IVs give you the vitamins and minerals, but we're putting it directly into your bloodstream. We're putting it into a vein. So you get 100% of it. The bioavailability of things is how much gets out of your gut and into your bloodstream. And it's not 100%. Not everything gets out of your gut. So when we're giving you something IV, you're going to have 100% bioavailability. You're going to get all of it.
Yeah.
So you have to eat a lot more of these vitamins and minerals to get the amount in your IV that we put in the bag, because it goes straight in. You don't lose any of it through your digestive tract. So it's a great way to replenish. It's also great for people such as yourself, because when you have gut diseases, you may be malabsorptive. So your bioavailability is going to be lower than other people's. You can't absorb it all. You may have some inflammation in your gut. People with irritable bowel syndrome, people with inflammatory bowel like Crohn's, they don't absorb as well. They have this constant malabsorptive issues. People with lactose intolerance can have the same. And so putting something straight into their IV is going to be a lot better for them, because they're going to absorb even less than other people. Even less will get out of their gut. So for many times, getting hydrated, great thing. Getting 100% bioavailability of whatever's in that bag is going to replenish you faster. And then customizing what's in the bag. So we talked about Myers, we talked about chronic pain, we talked about GI, but there are lots of different ways that we can formulate things. In our wellness center, we ask you a lot of questions. We have different IVs available for lots of different things. Some that help with hair, skin, and nails from the beauty aspect of things, and that's great. Some that help with pain or GI. Some that help with energy. We have an IV that's built around performance for athletes. We've had a number of young athletes who are working hard through the week, and they've got their games.
I'm giving it to my kids because, they'll have practice
They're
for several hours
all the time because it's just so much. They're practicing in the morning, they're practicing in the evening, they're coming right home and doing homework, so they're not eating and drinking as much because they're so darn busy.
Yeah,
and they're pushing their bodies so hard that it's hard to get enough in orally. And then when they have a big tournament on the weekend, you don't need them to start behind the 8 ball. You need them to be at 100%.
Both of my kids have had them.
Yeah, and I think for our athletes, and you're going in Georgia playing an outside sport.
Hot.
Yeah, it's hot. You're sweating. You're going to dehydrate. You're going to start cramping. So giving people some electrolytes. There are things that go into the IVs that are vitamins, that are amino acids, and it helps with muscle recovery. It helps prevent cramping. So this is a lot of why professional athletes all the way down to student athletes will use IVs to help their body be ready to perform. You have
and
to
I'm
have
not mad
everything
about
on
it.
board.
Like, I think it's good.
I think it's great in that most of what we've been teaching people is during your sport, you need to drink water and Gatorade. No, you need to go in at 100%.
Yeah.
And then you can, once you're out there and you're working at your absolute maximum amount that you can give, you're going to lose.
Yeah.
So what you're drinking during the game is going to replenish
you don't
what
pass
you're
out.
losing during the game. If you start low, you're not going to get caught up during the game. Yeah, you'll pass out. You'll cramp up. You won't be able to
play what you need to do.
Yeah, to be able to perform well. So we have an athlete IV, a performance IV that we do. And I think a lot of athletes, people who are training for stuff, pushing themselves really hard, this is a great way to help them catch up because they're always using everything they've got and a little bit more. Mm-hmm. So this helps kind of keep them ahead. But we do want to really drill in and recognize for people that this is not a one size fits all. This is not safe for everyone. It is safe for most.
Well, and just from a medical, nursing perspective, starting an IV, you need someone to know what they're doing.
Yes.
There can be harm from this if it is not done correctly. You can
Absolutely
get
right.
infections and it not go in the vein. And there's other things that can happen.
There are also things that you should not push through IVs that can't go, that can be toxic to the veins.
Yeah.
And you need to have reliable people who've done their homework and they don't just go, oh, substance A is good for this. And then they think they're going to give it to an
you
IV.
need to get it from a reputable source and knowing that
there are
some
some substances you can only give intramuscularly or subcutaneously, and you don't want to push this into an IV. You can do harm. And so yes, you need to have a reputable source. You need to have medical people. You need to have someone who can consult and help lead you,
and someone
so
that's
that you're making
watching.
the right choice.
Things happen all the time. I've started IVs that have blown or something. And so when you're getting the actual stuff, someone needs to be watching you and making sure that you're being well taken care of too. So don't just be like, oh, I'm going to start this and then leave and you can just take it out. I can't imagine. I don't know that happens, but I'm just saying in general.
Yeah.
Make sure.
There are, unfortunately, anytime things are profitable, there are people who are going to unfortunately not do it well.
Yeah.
And so just be smart about where you go and make sure that you're well supported, and that it's safe and that they're getting their IVs and the stuff that they put into their IVs from also reputable compounding pharmacies. So yes, harm can be done, but it's rare.
Yeah.
Do I think it's a good idea? I do. I think most of us in our, hurry up and do everything at full capacity society are in a high dehydration and nutrient deficit.
People that are listening can't do it, but hold your thing up. Look at us. We're trying to be hydrated.
Promise you there is water
in these. So we do try to be hydrated. So I feel too, the trendy thing is cute water bottles. And so I feel as a nation, especially because of, brands like Stanley and Owala and I don't know, my mom got me this one because she said it said cute water things, as you do your drinking for the day. But, we are trying to hydrate. I feel that is more people are doing
And
that.
I think to that point, if you are doing well with your hydration, with your nutrition, and you supplement or take vitamins and you're getting what you need, you don't need an IV.
Yeah.
You don't need to go spend, because the other negative about these IV bars is they're not cheap.
Yeah.
A lot of these IV bars are costing anywhere from $100 to $300-$400. And now there are some wellness trends that they're putting into the IVs, things like NAD+. And so you want to know about some of these things, but it doesn't mean everyone needs them, but they're not cheap.
Yeah.
And so if you are well hydrated and you drink your, 80, 100, you should have an ounce of water for about half your body weight. And that's probably more half your ideal body weight.
Yeah.
And so, if you should weigh 200 pounds at an ideal body weight, you should have about 100 ounces of water. If you're around 150, then you're going to cut back to about 75 ounces of water. That's not easy to get in, but if you're getting that in and you're focused on it and then you're eating well, you don't need to go get something.
Unless you decide to run a marathon, which we joke about that we don't typically do. But if you are one of those people, I would say definitely get one. Our Scotty does.
Our
Scotty's going out
Scotty is an obsessive runner.
Yeah.
She is, but it is her happy place, and it does,
and she does
so
it
many
well.
great things for her. And she should keep doing it, and this is going to allow her to keep doing it. But when she has a big race or she's really been pushing herself, this is a great way to make sure that she's staying up. Because if you just ran 20 miles, it is really hard to rehydrate and get your nutrients back up. That took a lot out of your body.
Yeah.
So, our takeaways from this would be not everyone needs it, and don't go pay for it if you don't need it. B, a lot of people are underhydrated, don't have enough nutrients. An American diet is not easy to get all that you need. Or if your lifestyle is that you've just recently been sick, we have people who travel and they're in the airports and they get sick when they travel. So they'll come in and kind of be a little bit proactive and take an immune IV before they end up out in the airports and around all of the germs. And I think that's a great idea, to be proactive and kind of preloaded with what you need. So if you do feel like there are some needs, some wellness needs that this can meet, I think it's safe if you go to a safe place. I think it's a good idea. I think these will stay because I think people are benefiting from it. And get the guidance that you need. And as always, talk to your medical providers if you're not quite sure if it's right for you.
And if you're local, come see us.
Yes. And don't show up to any of these IV bars without letting people know what your medical issues and concerns are. If you have heart disease, kidney disease, diabetes, other things,
they need
make
to
sure
know.
people know, because they want to make sure that they can do what's best for you. But all in all, we think it's a great idea. And if you've never tried one and you feel like any of these things would benefit you, I would recommend it. And it's definitely something that's, I think, worth a try, particularly if you're trying to get to next level on something. So IV bars, we're going to go with Good
Go
Thing.
for it. Yeah.
I love how it's kind of a wellness thing too, and it throws bar in the name. It's like, we're going to the bar, but we're actually going to get well while we're at the bar. So it also makes you kind of feel like you're doing something fun. So give it a try. Thanks so much for joining us today. And until next time, take care of yourself.
We like to leave you on a good note, and today's Tell Me Something Good is from Dr. Sammy Chang.
Let's see. We just had 3 baby goats.
Oh.
And so that's something awesome because the kids got to watch the whole process.
The kids got to watch the kids.
There were kids who watched the kids come
That's what
out.
happens when your parent is a doctor.
The baby goats are awesome, and it's really cool to see the cycle of life, and the kids enjoy that.
I love it. Something good is baby goats.
Baby goats.
Awesome.
That was amazing.
That's awesome.
That is something good. Well, thank you for joining us today, and until next time, take care of yourself.